Tonight, we meet patients who want more than anything to go back to looking the way they did before they ever went under the knife. Chris Connolly looks at desperate redos.
As a curvy model back in the day.
That was a fun photo shoot.
Those are the same lips that you have now, is that right?
Yep.
This woman, who's asked to be called Jordan, had a face and figure that rocked on magazine covers, thanks, she believed, to her nose job and lip boost.
You know, full lips were the thing, and all my friends had it done, and I just went for it.
This is very deep.
I just had silicone put here.
Only now that she's 42, the silicone injections in her lips don't look quite so puckerably pert.
This will look like a lip that you were born with.
Right.
And her modified nose cuts down on her oxygen intake.
And in the nose, fixing the valves here, making it breathe.
Taken as a whole, her look no longer fits her outlook.
What do you see when you look in the mirror now?
I see someone who looks very fake, and it doesn't match who I am inside. It's upsetting. As you get older, things start changing and shifting and moving and shrinking, and it's frightening. So now I look in the mirror and I just see I look like I'm done, and I don't want to look done. People, instead of looking in my eyes, they're looking at my lips.
Her response? One final operation to repair what went wrong last time after her nose job and her lip injection. And, well,
I had a mid-facelift when I was very young. I don't know why I did it. I was 28 when I had it done.
Did you ever have anything done below the neck?
Oh yeah, of course. Who hasn't in California?
This little duckiness, this little poutiness will be brought in.
We're doing a revision facelift with a neck lift.
Longtime LA plastic surgeon Dr. Richard Ellenbogen says he spends most of his time fixing other surgeons' work. These operations are known as revisions.
50–60% of my practice is now revisions of bad plastic surgery. Nose jobs, facelifts, eyelid surgeries, breast augmentations, lumpy liposuctions. I have seen people who are suicidal who come in wearing masks so nobody can see what they look like. The list just is endless of things that are done wrong. So we're clear?
Yeah, that's beautiful. Perfect. Thank you. After he does all of this to me, I'm just going to age gracefully, you know, not fight it anymore.
Hi, doctor. How are you?
Good morning.
How are you?
God, I am so shaky. I don't know if I could do it.
On her day of surgery, Jordan's not fighting anything as she's pricked and prodded.
I'm going to draw a little bit on you.
And marked up.
I'm probably going to bring up the columella just a little bit like here.
And open your mouth. Perfect.
Soon she's wheeled in.
We'll give you an option, okay?
And surgery begins.
Knife, please.
He cuts the bumpy silicone from her lips.
Stitch canaculum. Is that good from that side?
Yeah, looks nice from this side.
Okay, now put it on 40 on the blue.
Oh, it's working beautifully.
And clears out and widens the tip of her nose.
It's tilted down, so it's a more realistic looking nose. Okay, let's get some tapes on here.
Nice job, Doctor.
Nice. It's Miller time. Open your eyes.
When Jordan wakes up, she takes her first clear breath since she can remember.
And take a breath through your nose. That's called breathing. Doesn't that feel good? Okay. Your lips are a little numb now, and they're not the shape they're going to be until the local anesthesia wears off, but they look really good and really natural. I'm going to let you sleep for a little while.
Will Jordan wake up as a more natural beauty? We'll find out in a moment. But she's not the only cosmetic surgery survivor with an issue or two.
Every time I look at myself in the mirror, I think of him. He messed me up horribly.
Marie Palomino is not talking about an ex-husband or a betraying lover. She's talking about her plastic surgeon.
I wash my face at night and look at myself and I think of that doctor. And
I'm
Every night you
upset.
think that?
Every night I think about him. He's in my thoughts. I see the dent or the bump and just start to think about how bad he treated me.
Years ago, a prominent Beverly Hills surgeon injected fat into her face, leaving a bump she can't stop obsessing over. And while a chin implant added an irregular contour to her look, Marie says another doctor's laser resurfacing of her face gave her a jawline scar.
I'm not happy. I just think that I should have left my face alone. In the beginning, you go through the pain because you think it's going to pay off. You think the result is going to be good, and then eventually, it will be all worth it. It gets to a point after a while that you just don't look like yourself anymore. If I can take back everything I did, I probably would.
I think it looks nicer if I tie it here.
For a 52-year-old woman who works hard to keep up her fit and stylish silhouette, and who has also undergone breast reduction and mini facelift surgeries, it has been a bitter blow.
Chin down just a tiny bit.
Like Jordan, Marie is turning to Dr. Ellenbogen in the hope that the revisions he makes will be the last cosmetic surgeries she ever has to endure.
The lines on the neck will be gone. The little dibblies on your chin will be fixed. You scared?
A little.
Give me a hug. Let's get this show on the road. Hold that.
The next day, Marie is marked up
I want to change this depth.
and walked into surgery.
Your head here.
Yes.
The pillow goes under your knees.
Okay.
This is the best part, honestly.
An incision is made near her ear
This is a revisional facelift. It's different than doing it the first time.
to facilitate the revisions to her face.
Fixing it the second time is much, much more difficult. Stitch. We're going to take out her chin implant next. Knife, please.
Her old chin implant is removed
It is awful. Look at it. It's not even an implant.
and replaced with a new one.
This is what he carved, and this is what a chin implant looks like. It's smooth, it's longer, it blends in with the jawline. Let's put the good one in here.
Finally, he uses fat from her midsection and stem cells extracted from the fat to smooth out various parts of her face.
We can actually put a little bit into the side of the nose to straighten the nose where it's depressed. Sponge. She's asleep, but if she was awake, she'd be smiling.
After the 2-hour surgery, Marie's bandaged up and wheeled to recovery.
You did very well. We're all done. Keep your hands down.
Don't touch your face.
Everything looks good.
Dr. Ellenbogen is thrilled with the results, but frankly, Marie is in a world of hurt.
You look gorgeous. Your jawline is perfect. You wonder why your chin was all irregular? This is what was in your chin.
Ridiculous.
I think you'll be ready to rumble in about a week or two.
4 weeks later, Marie is delighted with the revisions.
Hi.
Hi, I thought Eva Longoria was in my office there for a second. You look wonderful.
Thank you.
Okay, here it comes in 2, 1. Great.
But still regrets the work she had done way back when.
I am very pleased. I wake up in the morning and I look at myself and I go, it's nice. I see the improvement. Would I do it again? No. I would tell any woman, if it's not broken, don't fix it. Leave it alone.
I look so much more natural. I just feel awesome.
Jordan likes her results too, because her surgical do-over turned out to be a do-under.
People they don't know what I did. They just say, gosh, you look really great. What'd you do? It's so subtle, yet it's so different, and I'm just so pleased.